The Indian government has failed to cope with the second wave of COVID-19. India marked a grim milestone in the COVID-19 pandemic, reporting 332,730 new daily cases, highest one-day tally anywhere in the world, as its second wave and surges elsewhere raised new fears about the ability of health services to cope. India's total cases are now at 15.93 million, while deaths rose by 2,263 to reach a total of 184,000 approximately, according to the latest health ministry data. Patients are struggling to get beds in COVID-19 hospitals. There is especially an acute shortage of oxygen. Television showed images of people with empty oxygen cylinders crowding refilling facilities in the most populous state, UP, Uttar Pradesh, as they scrambled to save relatives in hospitals. Congress leader Rahul Gandhi says government is responsible for the current crisis over oxygen shortages and lack of ICU beds. Many people are creating Twitter accounts to seek help from those in positions of power. Officials manning helpline numbers said the hundreds of millions of mainly poorer Indians do not have access to smartphones or use social media. Angela Rasmussen, a virologist at the Center for Global Health and Science Security at Georgetown University, said the situation in India was heartbreaking and awful. It's a result of complex mix of bad policy decisions, bad advice to justify those decisions, global and domestic politics, and a host of other complex variables. An official response to a right to information plea, according to NDTV, released that out of 100 million doses used across the country by April 11, at least 4.4 million were wasted in few states, including Tamil Nadu, Haryana, and Punjab. Rajesh Bhushan, the Union Health Secretary, had recently pointed out that the problem was lack of better planning, not a shortage of vaccine doses. Kaushik Basu, a professor at Cornell University and a former economic advisor to India, said it is tragic the mismanagement. For a country known to be the pharmacy of the world, to have less than 1.5% of the population vaccinated is a failure difficult to fathom.